a.m. And today's program is powered by TeleDoc. Every Wednesday and Thursday, we feature trusted doctors from the TeleDoc network to answer your health questions live. The time right about now is 8 minutes after 10. My name is Fumi Bangbala. And today's topic is one where that many of us may not have heard of before, myself inclusive, but it's very serious. It's called Ludwig Angina. And despite this name, it's not related to heart angina. If you've heard of heart angina, it is basically a severe and potentially life-threatening infection that usually starts from an untreated dental problem. And today, this morning, we're going to be speaking with Dr. Chinyere Iraganachi. I hope I said that right. Who will help us better understand this dangerous but preventable condition. Doctor, you're very, very welcome to the program this morning. You're muted.
All right. Thank you so much. Good morning, everyone. Good morning.
How are you?
I'm fine. And you?
I'm fine, thank you. Can I ask, what team do you support? Are you a sports person?
I'm a Chelsea fan. I'm just waiting.
Up Gunners, sorry. Up Gunners, up Gunners. She's like, please don't mind me. I did not watch the match. My husband is an Arsenal fan, so I'm doing this in honor of him.
Okay.
So you can say congratulations to us. Yes.
Congratulations, Chelsea.
Thank you, up Gunners. How are you? Hope you're well. Hope you're good.
I'm fine. I'm fine.
Awesome. Okay, let's get into it. Dr. Chinyere, what is Ludwig Angina?
Okay. We start by introducing myself. I am Dr. Iraganachi Chinyere Cordelia. I'm a dentist.
Okay.
Presently working in Owerri FMC Owerri. Also, I run a clinic, private clinic, a light dental clinic in Owerri. Okay. So today we'll be talking about Ludwig Angina. This is a life-threatening infection that happens around the oral cavity. Okay. You know, in this part of the world, we neglect our oral health so much, thinking that we only see a dentist when we have pain or we need to clean our mouth. Mm-hmm. And this particular infection has been killing people all of a sudden because they've taken it for granted. I wish there will be a way I will be showing some pictures on this video. It would be nice for you to see how it is. So Ludwig angina is a particular infection coined from a Latin word. Ludwig means something choking, angere, they call it in Latin. Then Ludwig is the person that came up with this particular infection. Okay. So by description, it's called a massive film, browning, something strong that is swelling that you see around your cheek, your jaw. Mm-hmm. You notice that these things come gradually, but within 12 to 24 hours, the whole place is filled up and you see your tongue going up. That means when your tongue goes up, it covers your oropharyngeal pathway, making you to feel choking. And if nothing is done within 12 to 24 hours, the person will die. There's no two way about it. So some of the causes of this come from what we neglect every day. First, poor oral hygiene. Poor oral hygiene does not end in not knowing how to brush or you know how to brush. No matter how you brush your teeth, between your teeth, there are some debris that hang there that you may not bring out with your brush. That's why it is recommended you visit your dentist every 6 months so that to remove those debris, those plaques in between your teeth. What these plaques go ahead to do is when they hang there, they will now be forming a breeding ground for bacteria. You may not even notice. You may think you are still going along your way, and the thing will now continue. Before you know it, you start going into your gum, decaying gradually. Maybe one day you notice when you are brushing, blood will come out. You will think it's your brush that did it. That's a sign that something is happening to you. That if nothing is done, it will not enter inside. One day you feel like you're abscess. You feel an abscess. How you know that abscess is forming within your mouth is when you now start feeling salty taste without you taking salt. Salty taste. That's what you first feel. If nothing is done, you will now see visible abscess coming out and swelling around that particular tooth that is affecting. When some people see this, they will just, we endure pain a lot. They will just run to the chemist and take one drug and that thing goes. This kind of infection, you have a collective medication for it. It's not just one. So when this thing continue happening, you see yourself swell, the cheek swelling up. It starts from one side of the cheek. It now goes under, because within this cheek there is an invisible spaces. These spaces are only filled up when there is an infection. You see your cheek swelling up. Before you know it, you see it goes under your tongue, carries your tongue up and occludes your oropharyngeal airway inside your mouth. Yes, then it goes over to the next thing. Then it will not change your voice. You cannot breathe well again. You cannot talk well again. You will just be making sound. If nobody is there to help you, between 12 to 24 hours, you are gone. That simple height, like in a hospital, it has been taking people's life. Those we could save, we save them. But this simple thing people could have done by, when you see a swelling, or not even a swelling, when you feel you have a toothache or bad tooth, don't wait till you get so down to a point of that you cannot help yourself. Just call your doctor and solve this problem. Another one is what we call pericoronitis. This one are the wisdom teeth. The last teeth, people call it wisdom teeth. Sometimes it may not be formed well. There may be dirt packing behind that last tooth. So when that dirt is packing there, it was now a breeding ground for bacteria. Before you know it, abscess will form, another thing follows. Another one is a mandible fracture. When you have a fracture, or especially those that have road traffic accidents, if you have this kind of problem, you have a road traffic accident, you have a broken jaw, provided there's now a cut in your jaw, blood can gradually fill in and cause a problem to the spaces I'm talking about. They will not fill into these spaces. That one, even within 5 to 6 hours, if you have not done anything, you are going to die. So the best thing for you, in this country, you may the access of doctors are few. Thank God for this platform where you can make a call across. They will tell you what to do immediately before you get to the hospital. Because most of these things happen in the night, where people can easily die without help. But since we have this program, I think we should make use of it. Call your doctor and you will be told what to do first. Though the rest can be treated physically, but the first aid can also tell you what to do, and you do it and get better before you reach the hospital. Another cause is when you have maybe foreign bodies, when you are eating, like fish bone hangs between them. It can also lead to it. So there's nothing that is going to be neglected in this particular infection. So let's talk about some of the key symptoms and signs you should be expecting in this kind of infection, so that you will know what to do when it comes.
Okay.
Actually, this infection, the classical way you know that it's Ludwig Angina is when you have swelling both sides of the cheek and under the cheek, and it raises your tongue up. That's when you know, have a classical picture that this is Ludwig Angina. But before that, you are not supposed to wait till that. When you notice you start having a salty taste in your mouth, you have an abscess growing there. You have an abscess forming there. Don't wait. Again, when you notice in the course of this abscess carrying your mouth up, tongue up, you notice your tongue are pushing up, trying to occlude your oropharyngeal. When I call oropharyngeal airway, towards that place you have your tonsils where your food passes into. You see your tongue closing in that place. You will notice it because you are the one that have your body. Don't wait. Then you have difficulty swallowing. You cannot swallow again. You notice that this swelling is not allowing you to swallow. Know that something is happening to you. Then drooling, when you cannot swallow, saliva will be coming out of your
Yeah.
mouth. So that's another form that this thing is getting so serious. And you notice that it affects other part of your body. Your breathing, you start to breathe, difficulty in breathing. You notice your breathing has increased. You won't feel malaise, fever all of a sudden. These are the symptoms you see. But for the sake of not running into this toxic state, when you have a toothache, and you notice that this forming an abscess and they are bad, even though they are bad, they've not started forming an abscess, call us to save you before it enters into a situation that, because this situation, patients stay in hospital for almost 2 weeks for us to drain it and for it to get better. And you know what it looks like. You're going to spend the hell while staying in admission. So, but when you solve it earlier, it is not going to be like that. So again, it's when you feel that, when you know you have a toothache and you stop this self-medication, there's a remedy to it. I know that you need to come and see your dentist to remove it, but before then, don't allow it to get to this extent. Why I choose this topic? Because it has taken many people to their creator. Untimely death. This is what they could have done to save themselves. These things can lead you to what we call, you have aspiration, you enter into shock, and within 12 to 24 hours, if nothing is done, you are going to meet your creator. So let me do why I'm saying it now, so that we don't get a picture that everything about the mouth is easy when I have time. This one will not give you time. So that's why we are now hammering it, that anytime you have this kind of infection, or you feel you have any toothache, or you feel you have any swelling, small or big, it mustn't be big, so consult us, we will take care of you. Then the principle of treating it depending on the stage of the sickness. So that's why I said, when you see it as little as it is, please run and just make the call. We'll ask you some questions, we'll find out what's happening to you, and then give you the medication you need at that point in time. If it's the one we need you to come immediately, we will tell you. So I hope people understood me very well.
Yeah.
In conclusion, I will say this Ludwig Angina is a medical emergency. So don't allow yourself to reach the extent that you can't even help yourself and people have to help you. Some preventive tips I will have to give to advice I will give to people is, when you have a bad tooth and notice an abscess, don't go and self-medicate. There is a doctor in charge of that. Dentists are doctors that take care of the oral cavity. Let me use the opportunity to tell us what other things we do apart from you putting case cleaning mouth and then extraction. We also teeth fracture. If you
Okay.
have a mandibular fracture, road traffic accident, you see people that have this fracture, we reconstruct their jaws and also give them their facial appearance. We also, when you have bruises in your face, we are also the ones that take care of it. Also, we also do the orthodontics, braces, all these things. So apart from that, we also treat other infections that happen around your face. Don't think we only focus on your mouth, only your teeth, and but the way we neglect our teeth, you see what is causing to people out there, and the money they could have saved to take care of themselves, they are not paying even more than it and borrowing. So another one is, remember to form this habit of getting to your dentist and making that call to do your oral checkup. In the process of this oral checkup, they may find out that this is wrong with you, and you'll be taking care of it. So lastly, please, my dear people, do not wait until you end up as an emergency case before you come to us. We need you alive. Thank you.
Mhm.
God
Thank
bless
you
you.
so thank you so much, Dr. Chinyere, for that
Yeah.
short presentation. I mean, for me, hearing, you're correct when you say that a lot of people just assume that all that dentists do is just to clean the teeth, but it goes way beyond that. Why do you think people don't want to go to the dentist to check their teeth?
Um, why do I think? And all of them have their opinion. Like, I know that a dental treatment is a bit expensive than other kind of treatment. Maybe
Mhm.
that's why they take time before they come to us. But at the end of the day, when the pain is so severe, they don't remember that thing again. They just rush and come.
Yeah.
So that's what some of them complain, because the ones we had that come to me, they will tell them to come. They will say let them manage, but before you know it, they are calling you. Because anything you say, I will pay. God, please, because they cannot be at that pain. But I tell them, is it not better you come and just pay that little amount at that early stage than coming? Your money is now running hundreds.
Mm.
So that's what
Okay.
I think. I don't know what again. Maybe other have what they're thinking about.
Okay. I have a question on, you mentioned this, like I've never heard about this, like I mentioned, like I said at the beginning, but are there treatment options for this thing? You said it starts with the swelling here. Does the tongue ever go down? Because you were specifically mentioning the timeline between when it occurs and when it ends in, because we already know that you've been able to register well that this thing
Mhm.
leads to death. But the treatment options, what are they? Is it surgery? What is it? Drugs? What are the things that?
Okay.
Yeah.
First, first, the treatment option depending on your state of presentation. If
Yeah.
you presented, you are not yet in a toxic state. Toxic state, you are not yet, your mouth is not yet closed. You know, when your tongue occludes, bam, is closed.
It's closed.
You are now coming to hospital. First, we are going to give you whatever medication we give you first will be IV.
Okay.
Hmm? IV. Pass your, even if you call me, even if I want to tell you what to do, I'll tell you, is there a nurse around? I'll tell
Mhm.
you the IV to the person can give you fast, so that those swelling can come down. When you come to hospital, we drain it. It's usually. Then another one, if your mouth is not yet closed, maybe the swelling is still one side, you can swallow your drugs. I can prescribe that. You take it, start taking it immediately, because it's going to be taking 8 hourly. Are you getting it? So
Yeah.
that you will not get to that extent. But if your mouth has already closed, if you are not closer to me, I will ask you, please, can you get a nurse around you because I'm not there? If you can, I'll give you the IV. You buy, the person will pass it through IV. The next morning, you start coming to us, because we are going to drain. We are not taking you to theater. It's for me to just open up there and drain it, and keep you in the hospital for 5 to 6 days for everything to be drained and to get better. So,
So you drain it. So that's not so are there times where surgery is needed?
and we call it a minor surgery, because
Right.
I'm going to do it on your bedside sharp to save you. Surgery is surgery, but there are some major and minor. This one is a minor surgery to drain out, so that it doesn't go back into your oral pharyngeal and start affecting your chest. Everything, it can kill immediately. So the fastest way to solve this thing is, like I said and I emphasize, when you have abscess, even if it's small, or toothache, you give that call. I will ask you how it is. From what you say, I will know if you don't do anything, this thing I will not administer the medication for you immediately. Then when it comes down, you can come and see us to look at the offending teeth, either to remove it or to treat it.
Okay.
So that treatment model can give to the person.
Okay.
So
Okay. All right. And from you've kept on re-emphasizing that the moment you start feeling any discomfort in your teeth, go to
yes,
the hospital.
yes.
And you also established that over-the-counter drugs are not ideal because it can solve the problem. It can reduce the pain at that point in time. Does it get worse or it just returns?
Over the counter drug, like I said, if it's prescribed, why I said you need to consult with your doctor is,
Mm-hmm.
when I have the audience with the person, from my discussion with the person, I will ask you, what have you done before? What are medication? All these things we do as doctors. That will not give me a definite one I am going to give you to tackle it. It's not even
Mm-hmm.
one medication I will give you. They're a group of medication to fight it, because you know something about abscess has a way of neutralizing your drug. So
Okay.
most of the time we give, it's not only one medication we give for you to fight it. Then the next time, when it comes down, don't stay at home, because the source of that infection is still in your mouth. You will
Okay.
have to come to us so that we can either remove the tooth or treat it. Because even if I give you medication and it comes down and you go and sit at home, if that thing comes back, there's no medication that will cure it again. You have to come and stay in the hospital. ICU self is where you stay.
You stay.
So why the source of this program is to create awareness that if you see it little, maybe that's small, before it fills your everywhere, I can prescribe that medication. You may not need to come again. Are you getting the point? But if when it's not established that it's now so much in your face, even if I give you medication, as it's coming down, as it start coming, are you getting the point? So that medication is a source of helping you at that point in time, so that you will not die, which
Okay.
is very important.
Okay. Thank you so much. This is the Women Radio 91.7 FM, the voice of women, Nigeria's first and only radio station for women and their families. My name is Fumi Bangala, and we've been speaking with Dr. Chinyere this morning on the topic Ludwig Angina. Okay, doctor, for people experiencing dental pain or swelling, any sort of mouth infections, but they are not sure whether it is serious, how can telemedicine help them seek help early?
Okay, like I said earlier, like one woman that came to the clinic yesterday, she was telling me something about toothache. That she told me that toothache is even more painful than childbirth. I said, wow.
That's
I said,
interesting.
it's you that told me that more child. I'm a reverend sister. I'm a Catholic.
Mhm.
So I thought, okay, I may not have witnessed that, but since you are the one saying it, okay, I will believe you. So, what I said, those having tooth pain or toothache, since we have this program, as I said earlier, the pain is severe. When you call your doctor, we all can give you first aid.
Mhm.
It doesn't stop you there, because I know this pain does not allow them to sleep in the night. So you can call us, we give you the first aid. The next morning you start coming to us. So that's the advice I can give you. Again, is even if you don't have any toothache, form the habit of every 6 months you visit your dentist to remove all those plaques in the middle of your mouth, because you know this teeth we have, is very precious. When you don't take care of it, they will leave you. You understand the thing? When you don't take care of, you lose them. And when you lose them, the importance of having a good tooth is makes your aesthetics. You can smile well, you are presentable, you eat well, you can't even speak well if you start losing your teeth. You notice that your way of speaking have changed, especially when you work in public offices. So I advise that you don't always allow yourself to have this problem before you come. But when you have it, don't allow the pain kill you there. Don't allow the pain cause a problem. The pain has entered to their oropharyngeal pathway, gone up to a vein that's leading to the brain, causing this thing they call, let me use in a layman language, a thromba, a blockage in one of the artery going to the brain, causing stroke. It has caused myocardial infarction, the artery going towards the heart and causing people to have heart attack. And at the end of the day, how did it happen? They will say, is it from common toothache? Toothache is not common. Just ask those who are super fraudulent. So advice I can give to those people who need help, please put a call across where your dentist.
All right.
Who can help
Okay.
you. Thank you.
Okay. Now for children, does Ludwig angina, does it affect children?
It affects everybody, even children.
So in the case, because children who cannot even already control their themselves, how
If a child, sorry,
go on, no,
continue.
go ahead, please.
Okay, I should go ahead.
Yes,
If
please.
the child starts teething, the first teeth in the mouth, the mother should pay attention to it. Some of parents leave their child to have this. They have an infection called early childhood caries. The insides or the front of the mouth, you see it decayed. It decay. The bacteria attack can enter into the gum. You know, the gum, there are vessels, blood vessels around there. It can now enter into those blood vessels and puncture those blood vessels and start feeling pus. You see children coming to hospital, their cheek are swollen, like the one we had yesterday. The child was not talking again, even crying. We have to start give passing an IV fluid into the child to at least resuscitate the child before we start training. A child of 6 years old. Then after, when the swelling has come down, we now looked into the teeth and saw that all the molar, they are all bad, and that is the cause of that swelling. So children are not exempted, especially, I mean, the one that are teeth, not they already have teeth in their mouth. It's not babies, so they are not exempted. You
So
can also call us before it gets to that extent. Before you come to us, we'll also prescribe a medication for them. Then the next day they can start coming to us. There's also a remedy for them.
right, would you say that the food that what they put in their mouth, sugary substances, the kinds of food they eat, does that have any effect on on Ludwig angina, developing Ludwig angina?
The only thing that have problem is oral hygiene. Let's focus on children.
Okay.
When you take sugary, you feed your child with sugary things, their immune system are not as your own. You now expose them more to this infection. It starts with tooth decay first before it goes on.
Okay.
If you don't clean their teeth, you expected when you feed your child, you clean the child's tooth. You could have, if you're not, yes, you brush morning and evening, that's okay. But within those, maybe in between meal they are taking, you're supposed to have a white gauze that you use to clean their mouth after eating, though they may resist, but form the habit of doing it for them to keep their dental hygiene, and also reduce the way you give them in between meals. This
Okay.
biscuit and all these things they eat.
Mm-hmm.
If you must give them, form the habit of giving them apple, those nice fruits that can make themselves healthy. And breastfeeding mothers who breastfeed their child and sleep off in the night, it has a way of affecting, because you feed that child and leave those food in the mouth and sleep over. In the night is the time this bacteria acts very well in the mouth. That's why it's encouraged you brush before you go to bed. So they now take this opportunity over time. You feed your child. When the child cries in the night, you give the child tea in the night. And this thing continues, you are overloading the child mouth with infection as time goes on. You notice that child might have started decaying. You may not see it at first. Bacteria will be walking inside the ground and go on the ground. Before you know it, it will now surface to start seeing swelling. All these things, it's not that the food you are giving them is the problem, but how you take care of it after feeding them. That's where the problem is. Are you getting the point?
I do.
Yeah.
I do. Okay, let's keep moving. And then for prevention, so how many times you mentioned earlier that every 6 months you should go to the dentist to check your teeth and to clean your teeth, right? What else? What other hygiene habits
Okay.
should we
Yes.
develop?
The tips, and I must tell you, start from first. You have a good way of brushing your teeth. First, your toothbrush are supposed to be changed every 3 months. But if the mouth of the brush is bad before 3 months, you can change them. You know how these teeth God created these teeth. Some are coming down, some are going up. That's how you brush. You don't brush, you apply the front upper one first, then the down one, you take it up. You form a good habit. Those that have come to the clinic, they would uh, get this type of way of brush. Even some of my videos in Facebook or TikTok, I've demonstrated all these things, how to brush. Then the third one is visiting your dentist every 6 months to clean your teeth. In that process, we could find out that there are other um, broken teeth or holes in your teeth. And even we used to find out from patients that they have diabetes and they're hypertensive, because your gum reflects when you are diabetic and when you are not controlling it.
Wow.
Yes, your gum reflects it. Immediately we look at the gum, we will tell you you have diabetic and you have not been controlling it. So what's happening? We can also be a pointer to help you in that. So even if you are developing any form of cancer, we can easily dictate it through your mouth. So even we are the first class people that before, when you are taking a chemotherapy for cancerous cancer, with time it affects your oral environment and you may not be eating well. Before you start taking the chemotherapy, there are some treatments we have to do to give you before you go on to take that treatment. Dentists are the ones that do that. So you see, there are ways we'll be helping that some people are not aware of. So another preventive tip I also give is, I think I've said it earlier, forming this habit. As I notice most celebrities that form this habit of taking care of the oral, because they know they are always in the limelight. So
Yes, yes, yes,
so
very correct.
so when you come to us, it's not only that we're going to see, we may also see other things you may be suffering from. So that's my advice to them. And also reduce the way you take sugary things, because the tooth don't like sugary things. Even if you have to take them, which I strongly don't advise, don't use straw to take your coke. Just drink it and find water and rinse your mouth immediately. Though I advise strongly not to be taking sugary thing, because the teeth don't like it. The gum don't even like it. Let me just be using that language like that. Because when you start feeding them, they will say you don't love them and they will start leaving your body for you. So when you start losing your teeth, you will not like your appearance. When you start losing these teeth, let me tell you the truth here. Here, the tooth is what holds your face in shape, keep it symmetrical, keep it straight. If you lose this side, the teeth deviate to this place that have to get support. Then you now looking at people, their face are deviating because they've lost some teeth this side. If you lose here and here, you get older, you start looking older than your age. You see this place start going in. You will tell yourself you have dimple. You don't have any dimple. You've lost it. So
So then,
that is
oh my.
it.
Okay. Oh my. Oh,
So that is it.
all right. Okay, before we go, is there any final warning or advice you want to give to our listeners to remember about oral infection and Ludwig angina?
Okay. Well, as I continue to emphasize, there are different oral infections. When you have cancer in any part of your body, you can eat, build your immune system to take care of it. But when you have cancer in your mouth,
Hmm.
how do you build your immune system? That's why people die fast when they have cancer in their mouth.
Hmm.
Are you getting the point? So all these cancers we see in the hospital are just coming from bad oral hygiene, though some come from bad habits like smoking and
Hmm.
taking alcohol. Some come from that, but most ones we have, 95% are coming from oral hygiene to develop cancer. Then the predisposing factors will be this alcohol and for those who take it. So a strongly warning I'm giving to people out there is, I don't always wait when you come down with this kind of oral infection, because if you have this oral infection, you cannot eat now. You cannot eat food. If you
It
enter
can
that one,
swallow.
you
Mhm.
can't even swallow. How are you going to build the immune system? Okay, we pass nasogastric tube through your nose. Will you be eating only watery food now? Eh? So that's the one I'm giving. Let's start taking, because the number of population we now see in the hospital are something else. So I thank you so much. I thank you so much for this program to sensitize people and tell them about this, because the people are really neglected. But I noticed that people are coming up. The more
Mhm.
people are coming up now these days. So the warning I continue to give, please let us take our oral hygiene very well. And whenever we have any immune compromised infection, like diabetes, you have cancer, you have hypertension, make sure you take care of your oral health so that you can live well. Because your oral health, when it is bad, it's what we eat, it is what will kill you fast. It will kill you fast. That is it. But you will not eat well. Well,
Hmm.
how will you have build the immune system and take, if you take your drug and not eating well? That's from food. We get, you build the immune system from what we consume. So I advise them also, they're very important people to me. Those who have hypertension, diabetes, and any cancerous infection. Please don't hesitate to put call across. At least in your own case, we don't easily go to treat your, we give medication and give you some of the, prescribe a particular wash you have to use in your mouth for you to at least feel good before you come to us. We don't treat you immediately. So please don't hesitate to put the call across. Thank you.
All right. Thank you so much, Dr. Chinyere, for coming on today's edition of Radio Doctor. Truly, today was very insightful. And please, if you're out there and you've been neglecting your oral health, I'm adding my voice to myself as well. I said it 2 weeks ago that I was going to go to the dentist. I still haven't gone, so I just need to fix a date to be able to go with my kids so that we can.
Okay.
I'm big. May we not see you. I'm big.
All
Okay,
right.
thank you so much, Dr. Chinere. Thank you so much.
All right. Okay.
All right. Enjoy the rest of your day.
Okay. Thank you so much.
All right. This is still Radio Doctor on Women Radio WFM 91.7 FM, the Nigeria's first and only radio station for women and their families. And Radio Doctor is Nigeria's first specialized radio health program, broadcast Mondays through Fridays at 10 a.m. My name is Ludwig Angina. Do have a healthy day. Good morning.
All right.